Are you having trouble sleeping? Well, if so, the next couple of minutes could be really important. So, sleep's very, very important. It's very restorative for the body, and it's important that we get enough good quality sleep. But there are many things and hurdles that can get in the way of helping us to achieve that. Now, frequently, people are reporting poor quality sleep, either difficulty getting off to sleep or awakening during the night for different reasons. What could the reasons be? Well, often it can be stress. Anxiety can prevent us from sleeping properly. Pain is another thing. If people are in chronic pain, that can disturb sleep patterns as well. Sometimes if we've been in a different time zone or we've been working shifts, that can throw us out too. So there's lots of different things that we can do to try and identify the cause of sleep disturbance and remedy it. But it's important, I think, if you're having significant sleep problems, to go to your doctor, to chat through it, to perhaps get some investigations done in the form of underlying blood tests for any underlying causes, such as a thyroid problem or any major deficiencies, for example, in any micronutrients. And then what can we do about altered sleep problems? Well, number one is just basic sleep hygiene. So that's the process of trying to make sure that you wind down towards bed, that you avoid caffeinated or stimulating drinks or foods, that you do some relaxation, that you avoid screen time, that your room's nice and dark and quiet, and generally sort of preparing yourself. Sometimes a warm, milky drink can be helpful too. And all these things can get your body ready for a good period of sleep. And trying to keep a regular bedtime and wakening time as well is really important. If we're having trouble sleeping, then, as I say, following the sleep hygiene guidelines first and foremost is a good thing. There are online programs that can help improve sleep. Certainly in my sort of area of the country, through the NHS, we have access to an app called Sleepio, and that's a sleep improvement program. So that's good. So, there might be something in your area that the NHS has allowed access to through often their mental health department, through websites and things. So yeah, a sleep improvement app can be really helpful as well. In terms of supplements, I know that there's a lot in the media about supplementation. From my review of the evidence, things like magnesium as a chemical, I think from the evidence I saw that they suggested that the evidence is relatively sort of weak, and more studies are needed to see if there's genuine benefit. I think what I read was that there can be some benefit if people are genuinely found to be deficient in magnesium. So particularly the elderly population. So again, perhaps a reason to get some bloods done just to check these things. So supplementation could be a thing, but sort of, go carefully, speak with your pharmacist about that. Generally sort of being active throughout the day and then trying to focus on your mental health. Also addressing, as I said, any pain issues. If pain is a big problem, then discussing that with your doctor to see if there's an appropriate way of managing that pain as well, perhaps through techniques and medication. Really important too. So yeah, there's a lot of things that can affect sleep. There's things that we can do to help improve our quality of sleep. Obviously, there are sleeping tablets, many of which can be quite addictive and are best avoided. And only used maybe in extreme circumstances for high levels of stress. Essentially, yeah, talking to your doctor if you're having a problem, getting advice. Don't sort of delay, because if you have prolonged period of poor sleep, that can then add to mental health problems. It can create anxiety and depression as well, because you're not in a good place to be able to process and deal with the day-to-day stresses and struggles. So hopefully that's been a bit of a helpful chat about sleep. Hopefully I've not put you to sleep. And until next time, stay safe and speak to you soon. Thanks for listening.